Hello everyone, I'm Mark Tarr, President and CEO. For Encompass Health's fourth quarter update, I like to focus on some of the behind-the-scenes efforts that enable our company's continued strategic growth. Opening a new hospital requires years of preparation and coordination between our home office teams, the regional team, and the new hospital team. Yet we make it look easy because, much like our clinical processes, we've standardized these efforts and continually refine them. Let's take a deeper dive into our growth strategy and what it looks like to open a new Encompass Health hospital. Growth is a strategic focus because the demand for services continues to increase. If you think about the aging population, we refer to it quite often as the demographic tailwind. In other words, the increasing growth in the population of 65 plus creates this increased demand for our services. We've said that only about 13% of the patients that are eligible coming out of acute care hospitals make their way into an IRF. So there's this continued demand. It's important for us to be out there to meet the demand for our services. And then, as a publicly held company, we have an obligation to our shareholders to continue to grow where we can. Well, our development team has done a really nice job in developing a bed need model. It's data-driven, so we look at marketplaces based upon the number of 65-plus population. We look at competition. Are there other IRFs in that marketplace? If it's going to be a joint venture, we look at the aspects of our partner in that marketplace. We look at the availability of staff, which is a growing challenge as you go along. So there are a lot of factors that go into our ability to look at a marketplace and assess the bed need and whether it's a market that we want to grow. Yes, the prefabrication has been it's an evolving approach to building our hospitals. It first started with our partnerships with Blocks, which is a company and factory that's based here in Bessemer, Alabama, where they have pre-manufactured bathrooms and head walls. And they would make them here. They would put them on a flatbed truck and then ship them off to our job site where the hospital goes, and then they would put all that together. So this prefabrication process has only continued to evolve now. We are building entire patient rooms prefabrication. And as a matter of fact, we're in the process of building a hospital down in Houston, Texas now, down at the Texas Medical Center, which will be our first hospital that is 100% prefabrication. So this prefabrication allows us to have what we refer to as speed to market. It reduces the amount of time it requires to build a hospital and get up and start taking our first patient. There's also less waste in terms of, think about the building materials, prefabrication. You have the ability to eliminate waste in the process. So all in all, it's been a real plus for our ability to continue to look for ways to innovate our building methods. Yeah, so leading up to opening a new hospital is critically important for us to get out and tell our story. You know, what do we do in an inpatient rehabilitation hospital, or what is this company all about? How do we differentiate ourselves from other post-acute providers in the marketplace? If it's in a marketplace where we may already have hospitals and we're adding a second or third hospital in maybe a larger city or a larger marketplace, then we'll utilize our existing staff there to kind of talk to discharge planners, physicians, other referral sources, just kind of get our name out in the community. If it's a new marketplace, then we'll use the resources here from the home office to better market our name and get exposure for inpatient rehabilitative services that way. So yes, it's critically important as we lead up to opening our hospitals that we're able to tell our story so that people understand what we're doing, what types of patients we treat, and the differences between an Encompass Health Rehabilitation Hospital and other settings like a nursing home. Well, 2023, and including the fourth quarter, were very strong periods of growth for the company. If you look at our total discharges, we had over 8% total discharge growth, almost 5%, 4.8% total same-store growth. Both of those are really strong numbers. We added 8 hospitals, which accounted for almost 400 beds to our total bed count. So yes, it was a very strong year, and we saw that in both discharge growth, number of beds added, and hospitals we were able to bring on. I attribute Encompass Health's continued growth and success to you. We couldn't do what we do without our employees' wide range of skills and expertise, as well as your commitment to upholding our shared values. Whatever your role, I hope you feel appreciated and proud to work for Encompass Health. Kudos on a job well done in 2023, and here's to another great year.